And now to Matters Health, where a report from Unicef and the World Health Organization highlights that millions of children around the world are at risk for measles, one of the most contagious and severe childhood diseases that take the lives of hundreds of children globally each day. Last year alone, 21.9 million children missed the routine measles vaccination in their first year of life, and 13.3 million did not receive their second dose, placing children in under-vaccinated communities at risk of outbreaks. There is need to create more awareness of vaccination, even as the International Vaccination Week comes to a climax, as Elizabeth Kisiangani narrates.
Vaccination is an integral part of a human being from when they are born to enable their bodies fight viruses and diseases.
They contain substances that teach the immune system or the body how to fight a specific infection. And so at any point, even if one is to get that infection, they are not at risk at severe illness.
From the time a child is born, there are vaccines that are important to prevent serious illness in children and adults, as well as reducing the number of children affected by many highly contagious diseases, including tuberculosis, polio, tetanus, whooping cough, among others.
So after the 6, 10, 14 weeks, then we have the vaccine at 9 months, which is measles and rubella, and a booster is given at 18 months. And measles and rubella is a very important vaccine because measles can cause serious illness, right? It can cause severe diarrhea, severe pneumonia, even affect cause brain damage, which can result in severe morbidity or mortality as well.
Therefore, Dr. Lydia Patrick advises that children who default any form of vaccine be traced to enable them catch up on the vaccines. Digital transformation has made this reality in many health facilities.
These children who have defaulted, whether at birth or later on, are traced and through these community workers and eventually captured, and eventually they get catch-up vaccines. Other ways is through the supplementary campaigns that happen, right? Because they're usually outbreaks. So some of these who have missed eventually also get.
To this end, there is a need for the government to ensure sufficient supply of vaccines, especially in public facilities, to ensure access to vaccines by mothers wherever they avail their children for vaccination.
The challenge comes with some of these vaccines, the baby-friendly vaccines. One, because of the companies that manufacture them, right? So some have stepped back from manufacturing them, and so we've not been getting a lot of support. So it's people, individual companies that have to take up that that position, and so you find that that's why we have some stockouts sometimes, whether in the hospital or a country issue.
Reporting for Sundown News Outlook, I'm Elizabeth Kisiangani.